Hi, my name is Sanjna Kulkarni, and the topic I've chosen is human papillomavirus. Human papillomavirus, HPV, is a group of sexually transmitted viruses that will, at some point in their lives, infect about half of all people who have ever had sex. Some infections do not cause symptoms and are cleared by the immune system, while others may lead to genital warts in men and women or cause cancer of the cervix or other genital organs. So the why of the problem is that HPV is easily passed between sexual partners who are unaware that they're infected. Most often, symptoms of this disease are dormant and HPV will go away on its own. So this makes transmission common because people may fail to practice safe sex if they are unaware that they have the disease or if they have no signs or symptoms of the disease. The how of the problem: HPV is spread during sexual contact from vaginal, anal, and oral sex from mother to child during delivery. The where of the problem: it was first discovered in 1956 by a group of scientists, but it wasn't until 1984 that Harold Zerhausen discovered, cloned, and attributed cervical cancer to two specific strains of HPV. His research largely contributed to the production of the vaccines for HPV. So, risks for a community in the future: these are similar to past and present risks, but anybody who is sexually active is at risk for human papillomavirus. It's so common that almost every person who is sexually active will get it at some point in their life if they're not vaccinated. Most people with HPV do not actually know that they are infected, and they never develop symptoms or health problems for it. However, when it doesn't go away on its own, it can cause problems such as genital warts and cancer, including cervical cancer and cancers of the vulva, vagina, penis, or anus. It can also cause cancer in the back of the throat, the base of the tongue, and the tonsils. The types of HPV that cause genital warts are not the same types of HPV that can cause cancers because there's many different strains. People with weak immune systems, those who have HIV and AIDS, are more likely to develop these health problems from HPV because their immune system can't fight back the disease. Etiological factors usually cause warts and papillomas, which are non-cancerous. These warts can be common warts, those on the non-genital skin, or genital warts that thrive only in squamous epithelial cells in the body. High-risk types of HIV have been linked to cancer of the vulva, vagina, cervix, anus, and penis. These are some pictures. So the first one on the left is a common wart, and the one on the right is a respiratory tract tumor. These are both diseases that can result from HPV. So 2 public health prevention strategies. So one of them is vaccination. HPV vaccine protects against diseases and cancers caused by HPV when given in the recommended age groups. There are 2 doses of the vaccine that should typically be given around age 11 and 12. So another prevention strategy is practicing safe sex. So using latex condoms correctly every time can lower the chances of getting HPV. However, HPV can be infected in areas not covered by the condom, so this doesn't ensure full protection. How HPV was handled historically and worldwide. The HPV vaccine was approved for use in the United States in 2006. Before this, the only recommended prevention strategies were abstinence, monogamy, and the use of latex condoms. HPV is the most common viral STD worldwide. Unfortunately, the cost of vaccines makes them unattainable for much of the world. A large percentage of young women are infected every year, and due to lack of resources, 80% of cervical cancer deaths are prevalent in third world countries. So, preventing the recurrence of HPV. The CDC recommends that vaccination of all boys and girls ages 11 or 12 years old. Catch-up vaccines are recommended for men through the age of 21 and women through the age of 26 if they didn't get vaccinated when they were younger. Since it's recommended, there has been a 64% reduction in vaccine-type HPV infections about women in the United States. So my personal opinion on preventing HPV in the future is I believe in vaccination. I agree that it's the most effective and realistic way to prevent the further spread of HPV. I don't think that it's always ideal to believe that people will abstain or practice monogamy, and in a lot of places people are unable to have access to condoms or practice safe sex. So I know the vaccine has shown 100% protection against cervical precancers, but there's been many studies showing this, and genital warts, and it's also been licensed as safe for the FDA. These are my references, and that's the end of the presentation. Thank you very much.